breeze blow. When your hands are tired of working, let them breeze blow. Rest your head and in the morning start again, again.
Oh, there, he'll be online. Okay, we're live? Okay, hello and welcome everyone to the OCTAResearch virtual press briefing, a national and COVID situationer. We're trying a new format, doing this press briefing on Facebook Live. We'll also be posting this video on YouTube tomorrow. And on that note, yes, feel free to record media. Let's see how this goes. Thanks to the audience and press for taking time out of your busy schedules to be with us today. And I'm James Kim, your host for today, and I'm the CTO of Technomancer. Mr. Perlin and Mr. HB are in the background, helping making this happen. We ourselves, we make websites and cloud-based systems, and we're helping OCTAResearch stream this event online. If you need help building a website, please contact our Facebook page directly. Now that's out of the way, I'm going to share my screen now. Is that share screen? Oh, no, not camera. Oh, where's that? Was camera? Stop sharing. Share screen. Start now. There we go. So here's our schedule and guests for today. So first we'll have Dr. Guido David. He's a PhD and a fellow with OCTAResearch, and he's going to be talking about the state of COVID-19 in the Philippines. We'll also have Father Nicanor Austriaco. He's an OP and PhD and a fellow of OCTAResearch and a professor and molecular biologist. He's going to be talking on vaccines and the virus. We also have Professor Ranjit Rai, MPA, fellow and OCTAResearch. He'll be talking about the OCTA-TNB survey results. And lastly, we'll have Mr. Joey Concepcion, the founder of Negosyo and presidential advisor for entrepreneurship. He'll be giving his response to these presentations. Let me unshare. Okay. And as you can see from the schedule, we have some time later on to answer questions from the press and audience at the end of the speakers' presentations. So just put your questions and comments in the comment feed, and we'll try and get to them. No swearing or name calling. Let's try and keep this discussion civil, respectful, and professional. And we're really excited about trying this new format, and we all hope you like it too. And with that, let's give the floor to Professor Ranjit Rai. Dr. Guido David, I'm sorry.
Hi, good morning, everyone. Thank you for attending. Sir James, there are several requests from our media friends to record. How do we give them permission to?
They want to record this presentation itself?
Yes.
Well, it's going to be recorded anyway, but let's see, meetings, security, I'm not.
Yeah. We can solve that. Don't worry. We'll give them all access to recording while James solves that problem. Can you also give co-hosting to Miss Mina Akram? Yeah, James. Okay.
Okay, Mina. But this conversation is going to be on Facebook Live anyway, so they can download it from there, right?
They are also asking what the link is to the Facebook.
It's on your Facebook page.
What OCTAResearch Facebook
recording
page.
In progress.
Yes. Oh, someone's recording it already.
Okay, good. So yeah. Okay, so we'll continue now since people can now record it. Yeah. So right. Professor David, can you start?
Okay, so good morning, everyone. Thank you again for inviting me. Thank you for attending this event. So good morning to our friends from Negosyo. Not sure if PA Joey Concepcion is here already, but good morning also to our friends from the media. So I'd like to share a quick situationer. So obviously there has been some developments. Well, I mean, not some, I mean, in terms of, the alert level system has shifted. So, and to start, I want to again show what we had as a projection in a Negosyo forum last. This was in August 23, and in that forum, I presented two projections of OCTAResearch. The ones you can see in gray and green, and that was a projection until September 30. And you can see that the actuals, which are the ones in blue, really were within these two projections actually. So, and that anyway, that was just an introduction. But here's an outlook of the, or at least a perspective of the COVID cases in the Philippines from March last year until present. And you can see that, well, there were three major waves or surges that happened. One was in July of last year, and then another around March of this year, and then the most recent one's the Delta surge. So yeah, we have this kind of discussion with, I have this kind of discussion with Father Nick all the time. So we can see that after the first surge, and these were all driven by variants, the D614G variant. I'm not sure what its other name is. I think it's called the B1 variant. It's the ancestral variant of the Alpha and Beta and the Delta. But we can see that after the first surge, we sort of plateaued at around 2,000 cases per day in the entire country. And that was around 400 cases per day in Metro Manila, which I'll show later. So we didn't actually get to decrease it from those 2,000 cases. And then came another surge due to the Alpha and Beta. And then it was now down to around a baseline of about 5,000 cases. And then the third surge, the Delta. But now what we're seeing is that the number of cases has decreased to around the same level as the red plateau here. Will it decrease further to less than 2,000? We will see that within this month, within the coming months. We have reason to be a little more optimistic now, even though last time we were not able to decrease it below 2,000 cases. If we look at the NCR, around the same time, we plateaued at 400 cases, and then came the Alpha and Beta. And then it plateaued at around 600. It was not clear if this was a plateauing because the Delta variant had already started to infiltrate the NCR at that time, and we had another surge. I also like to mention that in this graph, we can see that each variant brought about a bigger surge than the previous one. So the Alpha and Beta was, in fact, it reached about 10,000 cases on average from 5,000 from the first variant. So each time it actually seemed to have doubled the level of the surge. It was more massive nationwide. Although in the NCR, it was around almost the same level between Alpha, Beta, and the Delta. The difference was that the Delta took a longer time. And again, we have a decrease down to around 400 cases. The question, of course, is have we plateaued, or are we going to be decreasing further in the NCR? It looks like the decrease may have slowed down a little bit. If you look at the graph, that's up for discussion. This is in Cebu City, other major metropolitan area. In Cebu City, the plateauing was at a very low level. In fact, it was at around single digits late last year. And then the Alpha surge, and then the Delta surge, which is about 50% higher than the Alpha surge. We think that 50% increase has some significance to it. But anyway, they have now been able to decrease the cases in Cebu City again to a manageable level. In fact, it's a low level. It has a low ADAR. How about in Davao City? In Davao City, the Alpha Beta surge came at a delayed time, and right after that surge came the Delta surge. So it was two successive surges in Davao City. So they were relatively at a good level before these two surges. Of course, the question again is, are they going to going to decrease to that level, which we see in the red circled area there. I also want to show the reproduction number in the entire Philippines. The reproduction number that we calculate is the one in orange. And other academics in the country actually use the EPI forecast, which is a foreign developed calculator for the reproduction number. And I plotted it here as well. The EPI forecast is based on an SEIR model. So the reproduction number tends to be a little lower than our SIR-based reproduction number. I mean, I don't want to get into the technical aspects of it, but they're based on slightly different models. But we can see that when the reproduction number that we see is around 1, it's also around 1 in the EPI forecast. So the actual value of the reproduction number, I mean, I wouldn't say it's not relevant. It is relevant. But what we are also focusing on is the trend. When we have a reproduction number below 1, the EPI forecasts will also generally see a reproduction number below 1. So their values tend to be lower than ours, but they show the same trends. And this is a rough estimate of the vaccination level, but Father Nick will be talking about the vaccination level. But we could see that in terms of the ADAR of the country, which is in blue, the decrease happened sometime at around 15% full vaccination. Okay, so there's some relevance to that. It means that, or at least it suggests that the level of population protection is something that we're getting closer to. Okay, so this was actually posted on my tweet, comparing the NCR November 1 to 7 versus last year. I haven't been able to update this specific table, but we can see that we were in fact better compared to last year. An average of 400 cases. Last year, it was at 500. Fewer active cases, 6,000 versus 10,000. Even the positivity rate is lower. And the testing is actually 37% higher. So when some people ask that we're not testing enough, that's why the cases are decreasing. Actually, we are testing more than what we were testing last year by 37%. And that's why partly the positivity rate has also decreased to 4%, but I will be giving an update on this one. We can see that the only criteria or metrics that increased were the hospital beds occupied and ICU beds occupied. So just a snapshot of the major metropolitan areas. We actually see Cebu City and Davao City as having very low risk at this time due to all indicators being green. Even their ADAR is at green. NCR is getting close to that. The ADAR is still at yellow, but all other indicators green. And in fact, this was updated as of yesterday. Positivity rate in the NCR has decreased to 3%. I think I was checking. I think we might not have reached 3% in the past. I have to double check that, but based on what I looked at preliminarily, I did not find that we reached 3% in the NCR before now, before this week. So that's quite an achievement. Although WHO recommends 5% or lower, CDC actually, or some other institutions actually recommend 3% or lower. So we are at that level. Cebu City is also at 2%, a very good positivity rate. And just a snapshot of the NCR LGUs. All the 14 of the LGUs are classified as low risk, but 3 are classified as very low risk. And if you look at Navotas, it has a 0.37 ADAR, and they're just averaging 1 case per day over the past week. Other LGUs are also averaging single digits, like Malabon, 6 cases per day, San Juan, 5 cases per day, Pateras, 9 cases per day. So, and even Quezon City is now averaging less than triple digits, and it's around the middle of the pack in terms of ADAR. So again, if we're going to try to project the outlook this year and until next year, we have to, sometimes we could look at other countries and how they are doing. We can see that Indonesia is doing very well. They're now averaging about 500 cases per day, a very low number, especially for their population size. So we hope we're going to follow that trajectory. What about other countries? Well, the US also had to battle with the Delta surge, but you can see that their Delta surge is actually lower compared to the Alpha or Beta surge back in last year. And this is primarily due to the level of vaccinations that they have. And even now, they're already having a decrease in cases. So that's good. So I'm going to end here, but I'll be happy to take questions later. I really just provided a snapshot of what we're seeing right now. So far, basically, the summary is we're still seeing good numbers, very good positivity rate in the NCR of 3%. All indicators are looking good so far. We will continue to monitor the numbers. We are at the point where we might reach a plateauing sometime soon, or the cases might decrease further. We think it's going to be the latter. Why would cases decrease further? Because of the continued vaccination rollout. But of course, we could be wrong. It could start plateauing at some level, but it remains to be seen. So Father Nick will continue, and he will talk about vaccinations.
So good morning. I'm speaking to you from the United States. So I decided that I would discuss vaccines and vaccinations in the context of the United States, my second home country. And so what I would like to do is to talk about lessons that we can learn from the experience here in the United States. So I'm going to begin by talking about the NCR, but the way I'm going to do this is I'm going to compare the NCR to 3 large cities in the United States. I think it's very important to acknowledge that the Philippine pandemic is not one pandemic. It is multiple pandemics that are independent of each other, simply because population mobility is not as fluid as it would be in many Western countries. So we're going to focus here on the NCR. And what I have done is I put together a chart that compares the current status of the pandemic in Metro Manila, Metro Los Angeles, and Metro New York. And I am basically 3 hours north of Metro New York. And I have a meeting. I have to go and say a mass on Monday in New York City. So I will be traveling to New York City on Sunday. So what I would like to do is to compare the pandemic status of these 3 incredibly large cities to give you a sense, a contextual sense for how we are doing in the capital region of the Philippines. So for example, in total population, it's not surprising. The Philippines, the capital, is one of the largest in the world. So Metro Manila has a population about 14 million, in contrast to Los Angeles and New York, which is 10 million and 8.4 million. But one of the things that we do not realize is that the vaccination status of Metro Manila is quite significant with regards to these other 2 United States cities. So in terms of percentage of adults that are fully vaccinated, we're just talking about adults. In Metro Manila, according to the data that I received from the NVOC a few days ago, we are now at 89%. And partially vaccinated is now 98%. Now, I would like you to compare this to Los Angeles and New York. So in Los Angeles, it's 72%. Now, I could not find the number of just adults. So this includes 12 to 17 years old, just for Los Angeles. And with New York, though, you have 80% and 7%. So the vaccination status of Metro Manila certainly exceeds the two of the largest cities in the United States. Now, with regards to positivity rate, so the positivity rate, as Dr. Guido David pointed out, is at 3% and falling in Metro Manila. The comparable positivity rates in these two other large cities is around 1 to 1.5%. Now, in terms of the new cases reported, so this is the cases reported in the last couple of days. In the Philippines, in Metro Manila, it's about 300 plus or so. Now, look at Metro Los Angeles. It's now 1,174, and New York City about 848. And these are the reported daily cases of COVID in these two American cities. Now, what is really striking is that the hospitalizations in Metro Manila are significantly higher than in Los Angeles and New York City. And the reason for this is that, as Professor Guido David pointed out, many Los Angeles and New York City have been heavily vaccinated, and so they were spared the brunt of the Delta surge. While in Metro Manila, the Delta surge is still receding behind us, which is why the hospitalizations is high. The hospital occupancy is high, but again, is rapidly falling. Now, what I would like to do is to compare the mobility restrictions in these three cities. So in indoor dining with alert level 2 in Metro Manila, we have 50% for vaccinated, while in Los Angeles and in New York City, it is full capacity for vaccinated. Now, in terms of face masks in Metro Manila, from what I understand from talking to my mother and my relatives at home, indoors and outdoors with face shields. While in Los Angeles and in New York City, we are basically indoors only with no face shields. In fact, as you know, we've never really had face shields in the United States. Now, with regards to the international passenger quarantine, and I think it's really important to compare these. In Metro Los Angeles and Metro New York, which is typical of the United States, there is no quarantine for the fully vaccinated, but there is a pre-flight COVID-19 test within 72 hours. I'm aware of this because I was attending a conference in Germany last week, and I returned home to the United States on Monday afternoon. And basically, I had an antigen test in Paderborn, Germany. The day before, I was able to board the flight, and when I landed, no one checked anything. Now, in comparison to Metro Manila, right now we have a 6-day hotel quarantine and a 10-day total quarantine for fully vaccinated. And this 10-day total quarantine is you can return home after day 6 if you test negative on the 5th day. There is no, to the best of my knowledge, no pre-flight COVID-19 test. And one of the reasons why I highlight these differences is because I wanted to point out that the pandemic status of Metro Manila is comparable to that of Metro New York and Metro Los Angeles, two other very large cities. And so the question now arises about considering increasing the mobility of our Filipino citizens and relaxing pandemic health practices to make them more comparable to these two American cities. And the idea here, and one of the things what I have to point out is a lot of people are worried about a resurge of the NCR. I'd like to acknowledge, as I think Professor Guido pointed out in his pandemic curve, we have never had a resurge in the NCR during this pandemic. And when you see resurges in the United Kingdom, in Israel, in Singapore, it is primarily amongst the unvaccinated citizens or amongst citizens whose vaccination status has personal immunity has waned. And so I think it's really important that we acknowledge that given the high levels of vaccination and also the anecdotal high numbers of natural immunity found in the Philippines, simply because of the Delta surge, that the risk of resurge is relatively low. And this is what we learned from comparisons to the other countries. And we therefore should be much more willing to take risks for the sake of our kababayans. Now, this is why I have to bring up the experience of boosters and boosting our vaccinated citizens. So this is the experience in the United States. So in the United States, we are now approved for boosters. If you receive Pfizer or Moderna, you can actually receive a booster if you are 65 years or older. If you live in a long-term care facility, if you have comorbidities, underlying medical conditions, or someone who works or lives in high-risk settings. These are settings where you interact with many, many people. These will include individuals like healthcare workers. I'm actually included in this category as a priest because of the number of vulnerable people I interact with. And I am scheduled to receive my booster, the third Moderna shot this coming, not tomorrow, not this Friday, but the following Thursday. Now, what's really interesting is that we now have mix and match boosters in the United States. And for example, if you have 2 Pfizer shots, it's clear that a Moderna third shot is better than a Pfizer third shot. And for Johnson & Johnson, the Janssen vaccine, what we are seeing now is you should get a booster 2 months after your first shot. And again, most Americans are receiving an mRNA vaccine because the clinical trials have revealed that the boosting is much more significant if you get a Pfizer or Moderna after Johnson & Johnson. Now, what does this mean for the Philippines? It means that we, as we continue to vaccinate our kababayans, and of course, the priority has to be to vaccinate our kababayans who have not yet been vaccinated. We must prepare to administer boosters as our population immunity will wane after 6 to 8 months. And this is the first or second quarter of 2022. Otherwise, the risk for a Delta resurge will increase. So I wanted to highlight that the risk for a Delta resurge is relatively low at this time, simply because the Philippines vaccinated late. And so in contrast to Israel, for example, our vaccine immunity is still quite robust. It will, however, wane in the new year. So we need to prepare for that. Now, we also have to talk about vaccinating our children. Again, I will refer it back to the US experience. So in the United States, minors 12 to 17 years old were approved for a Pfizer vaccine several months ago. So at this time, we have 11.5 million American teenagers who are fully vaccinated against COVID-19. And 2 additional million have received their first dose. As of last week, children have now been approved with a special vaccine produced by Pfizer that is 1/3 the adult dose. And as in the past week, we are just talking of 1 week, we already have 128,560 fully vaccinated kids, and a single dose of 233,288 kids. Why do I raise this? This is important because we need to talk about the experience of children being vaccinated. So it turns out that serious health events are rare. There are myocarditis and pericarditis that have been reported for the Pfizer and Moderna shots. But let's talk about relative risk. So the risk of heart inflammation, if you get COVID-19, if you are a young male, is 450 cases per million. This similar risk for heart inflammation for a vaccine for the age range of 12 to 17, young people, is 10 to 20. And so one of the things that I point out is that the risk for getting a heart inflammation condition from the vaccine is substantially lower than the risk you would get if you got COVID-19. And I would like to emphasize one thing that I think a lot of people are not aware of. The world has resigned itself to living with COVID-19. What this means is that COVID-19 will be with us for the rest of our lives. And what this definitely means is that everyone will get COVID-19 sometime in the future. There is no way you can avoid it now. You cannot avoid the flu. You cannot avoid a cold. You will not be able to avoid COVID-19. So those who are not vaccinated now will get COVID-19 sometime in the next few years. And the risk for severe conditions is much higher for a natural infection of COVID-19 than it is with vaccination. So I talk about that here in the United States because there are Americans who believe that they can avoid COVID-19 for the next 10 years. And I point out that no one has ever been able to avoid the flu or the cold. We get it sometime in our lives. So now it's not a question about vaccination and nothing. It's now comparing the risks between vaccination and COVID-19. And that really is what we have to compare as we move forward in the future. So it's important to message to our kababayans that vaccinating our children with COVID-19 vaccine is very different from the context of Dengvaxia, because already we have 15 million American children who have been vaccinated with COVID-19. Dengvaxia was rolled out for the first time, tragically, in the Philippines several years ago. But we already have the experience of millions of Americans. We're not even talking about the European children who have been vaccinated. And so we can learn from them. And what we are learning from them is that the risks of these vaccines are much lower than the substantial benefits that we will get not only as individuals, but as an entire society. So in conclusion, I am speaking to you from the United States, from the state of Rhode Island. And basically here, the pandemic is ending. Everything is completely open. I can go anywhere. There are no size limitations. It's full capacity for every business, for every institution in my state. We wear masks indoors. We do not have to wear masks outside. In fact, masks are optional inside if you are vaccinated. And so if you go to our supermarkets, if I go to the Stop and Shop down the street, half the people in the supermarket are not wearing masks. And yet, we are not experiencing an explosion of COVID-19 currently in our society because of the significant vaccination rates, which are comparable, as I pointed out, to the vaccination rates in the NCR. And for those who are sick, the breakthrough infections are mild and can be treated with emerging novel COVID-19 therapies, including, of course, the two breakthrough antivirals from Merck and Pfizer, which will radically change the way we do this. So this is the post-pandemic normal, and this is our exit strategy. And for me, it's incredibly hopeful, and I'm looking forward to returning to the Philippines in a month. God bless you.
Okay, thank you, Father. And someone asked a question if they can start typing their questions, and the answer is yes. Type your questions in the chat, but we'll get to them at the end of these presentations. Next, we have Professor Ranjit Rai. Professor?
Yeah, hi, good morning to everyone. Thank you for attending.
Yeah. Should we bring up your PowerPoint presentation now?
Yeah, let's please do that, yeah. Yeah, to those asking questions, we can ask questions live. Yes, we can do that also. Yeah, you can write them down. We can ask questions live. And we'll do that after we present all of the data that we're supposed to present. No? So good morning to everyone. Thank you to the media and to all those who are viewing us on Facebook Live. Again, OCTAResearch will be conducting these press briefings frequently from now on, and then we will be using more extensively our website and our social media. So can HB share my screen? Yeah. So today I'm really just going to present data from our Tugunang Bayan survey. OCTAResearch conducts quarterly surveys, and they're national surveys, and we really want to share as much as we can, the data that we are able to cull and make sense of. So can we share screen?
It's being shared now, Professor.
Okay, just a minute.
It's on the first slide. You should see it on the Zoom call.
Yeah. Okay, just a minute. Yeah. So on the first slide, of course, we have to focus on the period of our own survey, which was conducted last September 11 to 16. This is the Tugon ng Masa survey, no? And this was conducted at This was a nationwide survey. And next slide, please. You'll see the technical.
Sorry,
Yeah.
guys, I'm not seeing any slide. And
Yeah, okay. Can we share screen?
the reporters, the media people are not also seeing.
Okay, I'm sorry. Geets, can you share my presentation? I have it. I gave it also.
Oh, it's being shared on OBS.
Okay, sorry.
Ayan, it's there.
Okay, so can we go back to the first slide? I'm sorry to apologize, no? Yeah, can we go to the first slide? Yeah.
No, you know what? If you bear with me, I'll download it and share it from here, so it will be shared on Zoom. So maybe while I'm downloading this, maybe you want to answer the first question.
Yeah. So before we do that, James, we'll let them know about the technical details of the survey. Yeah. And it was conducted last September 11 to 16. We had a total of 1,200 respondents, and it was conducted nationwide with a margin of error of ±2. No, and yeah, while we're waiting for the presentation to be shown. Okay, so while we're waiting for the presentation to be shown, as a group, we have some key messages now after the first two presentations. Number one, while we are experiencing a downward trend as far as COVID-19 is concerned, whether it's in the National Capital Region or for the rest of the country, our call, our exhortation, our plea to our countrymen, of course, is to continue to be vigilant, continue to be careful, continue to practice the minimum public health standards as defined by the Department of Health. And this is a constant call we make to media, and we hope that media articulates this position very clearly. We feel that the opening up of the economy is good for everyone, but we also believe that we should do so in a calibrated and safe manner. And that's why we want to emphasize before I present my findings, that there's a need for us to exhort our countrymen to follow the minimum public health standards, wearing of face shields, face masks, social distancing, of course, frequent hand washing, and of course, avoiding crowds, and enclosed areas. We also are exhorting our local government leaders, to continue to expand testing, tracing, and contact tracing in particular has to be provided budget. Much of contact tracing budget for the National Capital Region, for example, will be depleted by the end of this year. And for us to sustain the very good numbers that we are seeing, that have been presented by Professor Guido David, there has to be great cooperation among citizens, the private sector, local and national government. National government has to really ramp up testing in places outside of the National Capital Region. And this is where we're hoping that some work can be undertaken quickly. The budget for contact tracing will be depleted by December of this year, and we hope that budget will be a continuing one for next year, so we can sustain the gains that we have achieved this year. So, James, are we good?
Yes, it's being shared now. Sorry.
Yeah. Okay. Okay. So this is our survey, Tugon ng Masa survey. This is our Q3 survey, and it's September 11 to 16. Yeah. So next slide, please. And of course, it was conducted nationwide. The sample size is 1,200. The margin of error is a little over 2.8, plus minus 3. Yeah. Okay. Next slide. And these are the technical details. The sampling distribution all over the country. Next slide, please. Okay. Next slide. Yeah. So the first part of our report will look at our data, which we called in a survey conducted last September 11 to 16 on COVID-19. So next slide. So table 1 really focuses on awareness of adult Filipinos regarding local and national government initiatives to prevent the spread of COVID-19 in the country. And as you can see, 8 out of 10 Filipinos are aware of the programs of government as far as battling COVID-19, whether it's on the issue of testing, contact tracing, the building of isolation and quarantine facilities. There's less knowledge about initiatives towards upgrading the capacity of hospitals. But the key idea here is that people understand and are informed, okay, and aware of government programs to fight COVID-19. So the next question, next slide, yeah, is that we asked them about what they felt, no? Okay, if they approved of the government response to COVID-19. And we've been asking this question since Q1, since our first national survey in January. We have conducted 3 surveys so far. Last January was our Q1. Our Q2 was conducted last July, and our Q3 last September. And in Q2, last July, government got 80% of Filipinos approved of the government's COVID response. Of course, in our latest survey, you will see that there is a very significant decline, a 30 percentage point decline. No? As you can see, no, from 30% truly approved to 17%, and from 50% somewhat approved to 33%. So when you add 17 and 33, that's around 50%. And when you add when you compare it from last July, this is a 30% drop. And you can see that the drop was most significant in the National Capital Region, Balance Luzon, okay, and in Visayas, but largely in the National Capital Region and Balance Luzon. So this is the first headline, in a sense, no? Government, 50% of Filipinos approve of government COVID response, but this is a 30% drop from last quarter's rating. Okay. Next slide, please. Okay, and this is another area where we constantly measure public sentiment in. It's with regards to the willingness to get vaccinated with the COVID-19 vaccine. Okay, so here we asked the question, if we have a safe and effective vaccine available, would you say that, number one, you'll be willing to get vaccinated, or I will not have myself vaccinated, or I can't say if I will have myself vaccinated, or you're uncertain. No? So here you'll see that still majority of Filipinos want to get vaccinated in our Q3 September 11 to 16 survey. Okay, and significant number of those who want to get themselves vaccinated, 93% of those who responded come from the National Capital Region, okay, and in Mindanao. Okay. Now, I think the interesting part here is, the percentage of adult Filipinos who've decided that they will not get themselves vaccinated. That this is 22%. Yes, it is not as much as what you see in other countries, and it's still a minority, but this is actually an increase from last quarter. Okay, and you'll see that you'll see a great number of them, okay, in Balance Luzon, Visayas, and of course in socioeconomic class D and E. So I think this is something that's worth pondering on, and I think it's something that the DOH has to look into. Okay, the number of those who do not want to get themselves vaccinated increased. Okay, interesting in this table also is the number of people who at the bottom part of the table who have already indicated that they have been vaccinated. So when you look at the country as a whole, 36% have at least had one, okay, or have undertaken some form of vaccination. No? So for those with the first dose, that's 16%. Second dose, of course, 21%. And remember, this is during the survey period, September 11 to 16. It's important to understand, no, that this was also, the context is important because this was also the peak, no, of the last Delta surge that we experienced during the survey period, 11 to 16. And it had an impact on the approval rating as far as government response was concerned. That went down. And, it also had an impact on vaccinations, the willingness to get vaccinated. So next slide, please. So just some highlights, no? Just to give you a sense, 36% of the adult population is something like 28.1 million Filipino adults, no? Who have gone through some form of vaccination. Those who had their first dose, 16%, that's estimate, no? About 12.4 million adult Filipinos. And those who are finished with their vaccination, who have finished their second dose, it's 18.6 million adult Filipinos. That's the estimate. Just to give a sense, no, of these numbers. Next slide. Okay, so this is the comparison from quarter 2 and quarter 3. So the latest is quarter 3, September 2021. We have 61% willing. This is again a 5% drop, no, from July 2021, which registered 66%. Okay, and you'll see that the number of people who have decided not to have themselves vaccinated during the time of the survey also increased by 5%. Okay. Yeah. Okay, and this is again a table to show the socioeconomic classes, no, that are that have registered high, as far as not having themselves vaccinated. That's socioeconomic class D and E. Yeah. Next slide. Yeah. Now we asked the respondents, no, that 22% of the adult population have decided not to have themselves vaccinated. What were their primary reasons for not having themselves vaccinated? Okay, so I think this is very instructive. No, 65% of those who have decided not to have themselves vaccinated are not sure about the safety of the vaccine. No? 14% are not sure about its effectiveness. Okay, 9% have pre-existing conditions. But I'd like to give attention, no, to the next two, no, and yeah, this okay. Can we go back to the previous slide? Okay. Now this focuses on the issue of people thinking that there's no need for a COVID-19 vaccine. So that's 7% of the adult population. And the last one, which I want to emphasize is, and because it's this new, this is a sentiment that we called in an open question, no, in a sense, meaning we have a list of reasons. This particular reason was supplied by our respondents, by 5% of our respondents. So 5% of adult Filipinos believe that the vaccine basically can kill, no? Nakakamatay. Okay, and I think that's important. The data we're showing here is important because there's, I think, a very there's a great need, no, for an information drive to be initiated by government, supported by the private sector to reduce hesitancy as far as the vaccine is concerned. A lot of people are misinformed or uninformed, no? And they seem to be located in certain in areas around the country. No, you'll see a greater proportion of them in vaccine hesitancy in Balance Luzon, in Visayas, okay, and in socioeconomic classes D and E. So there's a great need for the Department of Health to ramp up its information campaign, and maybe for the private sector to support that campaign to help inform our citizens about the need to have themselves vaccinated. Given the paucity of time and the need for us to answer questions, I will end my presentation here and provide the media and promise to provide the media all the other slides that I meant to present here. There are just 2 or 3 more slides, but I think this is the key. These are the key headlines as far as my presentation are concerned. Approval of government response to COVID has gone down by 30%. Vaccine willingness. A majority of Filipinos still want to get themselves vaccinated, but the number of people who are unwilling to get vaccinated has increased from quarter 2 to quarter 3. And so those are the key points I want to emphasize, and maybe I can answer some of the questions to clarify during the open forum. Thank you. Thank you, James.
Okay, I'm going to stop sharing screen. Okay, thank you, Professor Ranjit Rai, for that insightful data. And our last speaker right today is going to be Mr. Joey Concepcion. And Mr. Joey, please take it away.
Good morning. First of all, I'd like to greet our partners, Professor Ranjit Rai, of course, Guido David, and Father Nick Austriaco. Our relationship with OCTAResearch basically started sometime late July, and that all basically emanated from the advice of OCTA for the private sector to lock down early in August. I remember that was August 8th. And our objective really was to save the 4th quarter, basically this Christmas quarter. And persistently, we've been discussing this with the fellows in OCTA, that this is the utmost important thing to save our MSMEs who have been confronted with numerous lockdowns through these last 19 months of this whole pandemic, and especially this year. And at that point, the government was still going to continue with the ECQ. And, repeatedly, I remember Ranjit telling me, let's do it now to save the 4th quarter. And we heeded the advice of OCTA, which I think was the best thing that we did. And it was not, we gathered enough business organizations to support us, but there were quite a few of the business organizations that, of course, were not for it. And it's not really common that you see entrepreneurs wanting to close down their own business. No? So it was a decision that was well thought of, well advised, and we saw the projections of OCTAResearch. Cases started to go up, moving towards September and close to October, and we saw it hit a high of even, I think, 24,000 cases at that point in time. And as predicted, also these cases dropped, starting in October, and we saw that started to plummet. We, as NCR, achieved 88% fully vaccinated. We were very comfortable that these cases will continue to go down. So, in a way, the act of the private sector, with the advice of OCTA, did result into what we see today. People think it was just a guessing game. I think OCTA is composed of good data analysts and good doctors who are able to really predict to a level of great accuracy a projection. And it's very important for the private sector to get to have visibility of what the future is. I mean, this is not fortune-telling work, but it is really data analysts that are providing the guidance is similar to weather patterns all over the world. And this is very important. No? We forecast weather situation to determine how businesses will react during very strong typhoons. In the same manner, in this pandemic, it's very important for us to see with better visibility what is going to happen in the next 3, 4, and 5 months. So the fourth quarter is definitely going to be a great quarter. Christmas will be saved. We will have definitely a Merry Christmas. Now, moving forward, our relationship with Okta has been formed into a formal relationship. We are now looking at a much brighter Christmas. We feel that the following initiatives has to be pursued vigorously. We've launched Vax to the Max. Basically, as Professor Ranjit explained, vaccine hesitancy is very high in the remaining Luzon provincial areas, including Visayas and Mindanao, especially in the CDE, the lower income bracket. And these people are easily vulnerable to people who tell them that vaccines are dangerous, a lot of side effects, people die. Many of the anti-vaxxers love just pushing all of this strong information. Why is the private sector successful in its inoculation drive with its employees? The difference is that the CEO all the way down to the supervisors and even the foremen really go to the people, our employees, and talk to them and explain every question that is, with a lot of doubt that these vaccines are not effective and that they have so much side effects. So we use the entire machinery that we have from our executives all the way down to the supervisors to really go one-on-one. And this was done by over 700 plus companies nationwide, and it is effective. So the same thing should happen with the LGUs. The governors, the mayors, and the barangay captains play that key role. It's the same between the private sector, the CEOs and the supervisors. Now in LGUs, the CEO of the LGU, whether it's the governor, the mayor, and the barangay captain, has to actively go down to its people and really mobilize a lot of effort in convincing those who are hesitant to change their mind, but that has to be based on facts. And I believe vaccine hesitancy will further be reduced, and that is the objective. It's very clear that vaccination is the key to coexisting with COVID-19. We have seen that with NCR. Now we have to replicate that all over the country to create the Philippine vacuna bubble that will be well insulated. The next thing that we have to do is to be able to secure enough doses for our boosters. Father Nick is correct that the vaccines do wane between 6 to 8 months. I would say maybe between 4 to 6 months. Sinovac is quite effective, but they don't last as long as the others. I think many people have criticized Secretary Galvez for bringing Sinovac. I believe he did the right thing because all of these branded, Moderna, Pfizer, and Astra vaccines were delayed. And even our vaccines, AstraZeneca, are delayed. And it's coming in huge numbers now. Same thing with Pfizer and Moderna. But we were left open without any vaccine. So Sinovac filled that gap, which prevented a lot of people from hospitalization and death. But then we can see that Sinovac definitely wanes. But so that we now have to give the boosters to those who have taken Sinovac, because these were the earlier ones who took the vaccines. So moving forward, it's not going to be 2 doses. It's going to be a booster every 6 months. So these vaccines have to be secured and have been secured. Now, the question is, who do you prioritize right now? Those who have not taken their 2 full doses or those who need the boosters? I believe we have enough vaccines in this country right now as we speak, and a lot more arriving, that we can afford to just open up to all sectors and have a fast lane for those in the priority sector. In other words, in a vaccination center, you would have the VIP or the fast lane for all of those priority groups, and you will have the standard lane for those who are not in the priority. And to me, that is the way to push this vaccination drive. And while Delta is on a downward movement, we have to continuously vax to the max these areas so that when, and assuming that Delta will have a surge again, I mean, then we are better prepared this time. So the lull should be used to vaccinate all of those in the rest of the Philippines who are at the 20% and below. And that's why we've launched a dashboard and we have announced Vax to the Max, so we can see in the dashboard the areas that are still lagging behind and the areas that are close to achieving 70%. 70% should be the minimum, but ideally 90% should be the target with Delta to really tighten and strengthen our bakuna bubbles, whether it is a Negosyo bakuna bubble or whether it's a family bakuna bubble. So that has to happen. We also have to vaccinate the 12 to 17, our children who are going to go to school. Parents will not want to send their children to school without these vaccines being given to the kids because they will be at risk being exposed. So this is another thing that we have to do. We have the vaccines that I've told Secretary Galvez. We have the Moderna vaccines that we purchased for our employees. We have now spare vaccines because many of these vaccines, Moderna in that case was delayed. We kept the vaccines and now we can use them for the children and even as booster shots. So that's in the vaccine scenario, that is very important. With the Dose of Hope group, what we're trying to do right now is to already plan what will happen June onward. In other words, we have to plan the booster shots. It will not be your regular vaccine anymore that you have 2 doses. We will be looking at giving booster shots every 6 months, the way I see it. So, but we have to already make these orders so that we are not left behind. So AstraZeneca is asking us for a meeting to be able to plan out the vaccine orders. Per Secretary Galvez, he will allow the tripartite agreement to continue for the private sector purchasing AstraZeneca, but the rest, Moderna, Sinovac, Pfizer, Sputnik, they will all be handled directly by the national government. And they will not move into any more tripartite agreements with these other vaccines. So it will be only AstraZeneca that will continue with the tripartite agreement that we have established last year. The next thing that we are pushing hard is travel. We need mobility, both domestic and foreign. We have been pushing very hard with IATF Secretary Galvez to allow, we brought down the quarantine from 10 days to 5 and 7 days. 5 days at the quarantine center, a facility hotel, and 7 days for the unvaccinated at the facility hotel. A total of 10 days, the rest will be quarantined at home. So that is currently right now 5 days in a facility hotel and 7 days in a facility for the unvaccinated. But the objective is to take this down to 0 quarantine. Now, in exchange for the 0 quarantine, we proposed basically that 48 hours prior to departure, those departing out of the destination, North America or wherever they're leaving, takes a PCR test. Then upon arrival, he takes another PCR test. That already is going to make it even much safer because right now, without this PCR test, the incidence is 0.6, less than 1%. So in a 777 flight of 377 people, that's barely one person that could most likely be infected. No? So the one person, imagine, it's very, very low. So we really should open up to balikbayans wanting to come home, eventually tourists fully vaccinated. So greater privileges should be given to the fully vaccinated by reducing the number of quarantine days or eliminating it entirely. America today is not starting November 8th, is not going to accept people, tourists or people visiting America who are not fully vaccinated. For their own citizens, they will accept, but they will have to go through a testing, PCR test. So the same thing can be adopted in the Philippines. So greater mobility is needed for us to save Philippine Airlines. They filed for Chapter 11, and we need to increase the number of people coming to the Philippines. Prior to the pandemic, it was at 40,000. During the pandemic, that dropped all the way down to 2,000. Now it's moving up to 4,000, but 4,000 is not even enough to make Philippine Airlines viable. They have certain commitments to the banks that they have to meet these obligations so that they will continue to fly. If we lose Philippine Airlines, then our entire tourism sector industry will collapse. So we can't afford. It's about time that Thailand and the rest of Asia are opening up to foreign tourists. We should do the same thing. There was a suggestion in yesterday's meeting with Ambassador Babes Romualdez, Secretary Tugade, and Concentrix. It's a group that is doing pooled PCR testing in America with the schools and the airports. 25 people pulled into one test kit. And the results are immediate. So that's being explored as we speak right now, whether we can do it in the Philippines. Right now, what's approved is 5 pools of 5. So taking it up to 25 is something that we will work on. But definitely, the move is to open up tourism. The governors that we met in the top tourist destinations have agreed to waive the PCR test already, to make travel a lot cheaper for our Filipino people, domestic tourism, to really move and improve and help these hotels who are floundering in obligations to the banks, that they will be able to pay their amortizations, their interest and their principal payments, because many of them have called me and say that they are really being challenged right now. So there is no choice but to really open up the economy safely. And hopefully, the last is to move to alert level 1, which I believe by December, at least December 1, we should move towards alert level 1. If, as Professor Guido has presented, and of course, OCTA, that these cases will continue to go down, and hopefully we continue to maintain it where it is. But let us not rest on that. Let us take a more aggressive role in really vaccinating our citizens, especially in the provincial areas. And if we're able to do that, then if cases do go up, but who cares if cases go up, provided those that are being infected are fully vaccinated, because it will prevent hospitalization. And that's very clear. So when we say, okay, cases are going up to 1,000, 2,000, let's lock down, let's hold back. Who are those getting infected? If it's the unvaccinated, yes, then we should be concerned. But if it is the vaccinated that are getting infected, then let's not be concerned about it. Of course, there is some risk that they will land in the hospital, but a greater percentage, 70% to 70, 80% of them will just get well at home. And that is when we will be able to move this pandemic into an endemic that we will be able to learn. And I think we are starting to learn how to live with COVID-19. So looking at 2022, I'm extremely bullish that I think we have the handle. I think we know what to do. Secretary Galvez knows what to do. Vaccines are here. They've been ordered. They're arriving. Let's inoculate. Let's vax to the max. And definitely 2022, we are not going to see the lockdowns that we used to see. They will be more granular in approach, which was a suggestion I made last year. And moving forward, I think we will not only have a Merry, Merry Christmas, but definitely a great 2022 New Year. Thank you.
Okay, thank you, Mr. Joey Concepcion. And thank you again to the other speakers as well, Dr. Guido David, Father Nicanor Austriaco, and Professor Ranjit Rai. So now I guess we'll open the floor to the questions. And there are a lot of questions in the chat. So how do we guys want to do this? I can read this online, or we can unmute each person one at a time and allow them to ask the questions verbally.
Okay, maybe we'll ask some of these members of media. Mostly, I mean, the people now here in the Zoom are members of media. So maybe we can unmute everyone, and then you just raise hands and just call on and quickly answer
Okay, so maybe Mr. Red Mendoza is first on the list. Can you unmute him, Mr. HB?
Hi. Good morning.
Yeah, good morning, Red.
Good morning po. First to PA Joey, good morning po. Yesterday, Dr. Maricar Limpin of the Philippine College of Physicians said that the government should not be rushing towards moving to alert level 1. And this is also a question posted to Doc Guido. What can you say about this? Because these, the PCP are the first ones to say that they are they are yung nabubulunan yung system. And the weight of the PCP's opinion really matter because sila yung frontliners. So what can you say about the PCP's call na wag munang i-move towards alert level 1 ang NCR because there is a possibility of a surge in cases? PA Joey or and Doc Guido.
Well, my own view there is as the numbers continue to go down, I think we should open up. And I understand our medical doctors because they've been in the forefront. But I hope they also understand the plight of many of our MSMEs who are really challenged at this point in time, being able to even meet their loan obligations and even this 13-month pay that is coming due this Christmas season. So we really have to try to open up and save most of them while the cases are going down. And as you know, we've been very vigilant. We did the right thing in August, and we will do the right thing if it comes to that point.
Yeah, and I'd like to add to what PA Joey said. Yes, we of course see that the business sectors, they're very vigilant and they're very supportive. Actually, at least the group headed by PA Joey. You know, when we see rising cases and when we see hospital beds are going to be threatened, we will make this this alert. We will alert the public or the media and PA Joey Concepcion. But right now we see that what we're seeing is that the risk is at a level that is quite low, and that the risks of a resurgence, as Father Nick has mentioned, we believe are not as significant. I mean, there may be risks, but we can always calibrate our strategy if we're seeing a spike in cases, that we can push back some of the measures and the restrictions that we're loosening up if ever it comes to that. So we can make that recommendation. But right now, cases are down. As long as people are mindful of their health protocols, we are not seeing a significant threat in a rise in cases. And of course, we understand the doctor's perspective, and we support them. But like I said, if we think that hospitals are going to be threatened, we will make this recommendation. But right now, the hospital utilization in the NCR is at 28% or 27%. And this is already considering the fact that they have moved some of their COVID beds already back to non-COVID beds. So in fact, the percentage could be much lower if we're talking about just the capacity or the potential of these NCR hospitals. Thank you.
Okay, thank you. And well, how about this? Why don't you message the group chat to the reporters' questions, and we'll just take them in the order that they appear. So the next on the list is Mr. Greg Gregorio. Can you please unmute him? From TV5. Mr. Greg Gregorio.
Hello, good afternoon. Good morning.
Yes, good morning, Greg.
Hi, Prof. This question goes to Father Nick po. Maybe a clarification, because the Department of Health has previously stated that Philippines cannot be compared to other countries such as the US because of many factors, including the difference in resources and availability of vaccines. So maybe I'd like to get how would OCTAR respond to this, Prof?
So thank you very much, Greg, for that question. I would agree that one of the significant differences between the United States and the Philippines is its healthcare infrastructure. That's very clear. However, I think the differences in the availability of vaccines has passed. So just like PA Joey has pointed out, we are now in a situation where there's excess supply of vaccines in the Philippines in the same way that we have an excess supply of vaccines here in the United States. And we can, in fact, begin to compare populations that have similar, if not higher, vaccination rates. And I think that is what is significant. We have to, of course, watch the hospital occupancy, but we are dealing with a biological reality, and the virus is going to have to spread in a population of human beings. And whether or not that human being is a Filipino or an American does not make a difference with the virus. And so we're looking now at high vaccination rates in the NCR. And I believe, therefore, it's legitimate in order to compare the pandemic situation of the NCR in these two American cities, even though the health infrastructure is different, which is why it is striking, I pointed out, that we are at 2,000, hospital occupancy is still at 2,000, while in New York and in Los Angeles, there are about 700. But as Professor Guido pointed out, when you look at the overall numbers for hospital occupancy, they're still very good. I mean, 28% is excellent for hospital occupancy. And we have such significant headroom that we should be able to be flexible in order to see whether or not we can relax further, because the headroom will allow for a spike if we see one.
Okay, thank you. And the next question on the chat list is Ms. Carolyn Bonquin. Can you please unmute her?
Okay. Good morning po. For Professor David, several European countries are already facing another wave of infections. So kaya po sila nag-iisip na ibalik yung restrictions. So with the easing of restrictions here, how likely is it to happen as well in Metro Manila or other provinces, probably by end of the year or beginning next year? And for Sir Joey Concepcion, sir, I'd like to clarify lang po your statement earlier. You said, who cares if cases go up when people are already vaccinated? But we also do know that there are breakthrough infections even among healthcare workers. So sir, maybe more context lang po dun sa statement. Thank you.
Let me answer that first.
Yeah.
Well, what I mean by, and maybe Father Nick can help me out here. When we get vaccinated, we have the goal is we are prevented not from infecting other people, because we still can infect people because vaccination does not give you that full immunity, you know. So I'm referring to hospitalization, basically getting severe infection and hospitalization. So if let's say in NCR, we're close to 90% fully vaccinated, and if that person who gets sick is fully vaccinated, we should not get scared, because it can be, he will just get well at home. Most cases happen that way. 75% to 80% of those that are getting hospitalized are the unvaccinated, basically what we see. So there is far greater protection for those who are vaccinated from getting severely ill or being hospitalized. Now, if we don't believe that thing is true, and that is the result of being vaccinated, then why are we spending so much money buying these vaccines? We have to believe that these vaccines will protect us from severe illness and hospitalization, which hospitalization hitting its capacity leads to lockdown. That's my point. And I think we should not panic unnecessarily that, oh, the cases are going up 1,000, 2,000, but who are the ones getting infected? If the population is 90% protected already, chances are that person getting infected is vaccinated and should be at least protected from severe illness.
So let me add to PA Joey's comment. So the experience here at my university, where we have vaccination rates of 98%. So we have a 98% vaccination rate in our community, and we have noticed several things. First of all, we still get COVID-19 positive people, but most of them are at this point asymptomatic. So the vaccination is able to protect their bodies, even though they're able to get infected in their nose, number one. Number two, we have discovered that it is increasingly difficult for these COVID-19 positive individuals to infect other people in their household. And so what you see is, because everyone is vaccinated, not only is the experience of COVID-19 milder, it is more difficult to transmit between vaccinated people. And so one of the things we have discovered here in our community of 5,000 individuals with a population protection of 97 to 98% is we can live our lives ordinarily. The positivity rates are less than 0.5%. And people do get sick because they meet other unvaccinated people outside the university. But for the most part, the university has returned to normal. And I think what PA Joey is saying is if we can attain sufficient population immunity in our capital, and then, God willing, in our country, what you will see is cases of COVID-19. You will see maybe even spikes of cases of COVID-19. But because these people, these citizens of ours, our kababayans, are primarily vaccinated, they will be protected from disease that will put them into the hospital and kill them. And so as COVID becomes endemic, you will just call your boss and you say, "Po, I got sick with COVID. I'll stay at home for 2 days." And that will become normal. We will not have to worry about people getting sick because for the most part, they will not get very sick. And now with these 2 new antiviral drugs, if they get very sick, we will just give them medication at home, 5 days, two pills a day, once in the morning, once in the night, and they do not go to the ICU. And so you can see there's a transformation now. The pandemic is becoming endemic. It will become the 5th coronavirus that is in normal circulation amongst human beings. It will just become an ordinary cold.
Okay, and I'd like to ask the first question, which is regarding Europe, and maybe Father Nick could also add to this because he was just in Europe recently. But I think when we compare the easing of restrictions in Europe to the easing of restrictions that we're doing here, I don't think they're that comparable in the sense that my understanding is when they ease restrictions in Europe, they're like really easing restrictions and like going back to the old normal, as in face masks are no longer allowed. Like Father mentioned, in the US, face masks are not even required. Even indoors, it's not mandatory based on what he mentioned. So I think while we're easing restrictions here, I wouldn't say that it's comparable with the easing of the restrictions in Western Europe and in the US, because we're still going to be following minimum public health standards. Now, when we no longer follow minimum public health standards, then of course there would be a concern. So that's why we still have to address the messaging that we still need to be mindful of these public health standards.
I would like to add too that in Western Europe and in the United States, COVID-19 is a seasonal respiratory disease. So what you are seeing in terms of the resurge now is not because of the relaxation of restrictions. The restrictions have been relaxed for 5 months. What you are seeing now is a resurgence because it is cold. And when it is cold in the United States, everyone moves back into their houses. And so you have higher local transmission. In the Philippines, it doesn't really get that cold. And so if you look at the pattern of the pandemic in the Philippines, it is never driven by the season. It has been driven by new variants, which is why it is so different that we be aware that when you talk about the West, I was just in Germany. Yes, they're getting a surge, but no one is really worried because for the most part, it is vaccinated people. The unvaccinated are getting sick, but they're being treated in their hospitals, and the vaccinated people are relatively mild. Nonetheless, they're forecasting significant increases because it is winter. And you will see next summer, it will happen in Australia and New Zealand as well, because as it gets colder, the cases surge. We will not see that in the Philippines. In the Philippines, it is driven by other dynamics, primarily new variants.
Okay, so thank you for that insight. Next question is from Ms. Wena Cos from ABS-CBN. Could you please unmute her?
And magandang umaga po, everyone. My question is for Professor David. According to the World Health Organization, can you hear me?
Yes, yes, I
Okay.
can hear.
According to the World Health Organization guidelines, the Philippines or countries need to maintain less than 5% positivity rate for 14 days at least to be able to say that we have the pandemic under control. But it also says that it can only be interpreted with comprehensive surveillance and testing of suspect cases. My question is our surveillance and testing comprehensive enough to truly say that the less than 5% positivity rate is actually truly remarkable?
Yeah, of course. That's a good question, and I can't comment completely on or regarding the contact tracing and the surveillance because we don't have that data. But based on some local government units that we were working on, the contact tracing efficiency is actually improved to almost 30, and the standard is about 1:37. So we're seeing about 1:30 in some LGUs. So the contact tracing is really good right now, and the level of testing is appropriate for the population, at least in the NCR. We're not talking about everywhere in the Philippines. There are areas which still need to ramp up testing, but at least in the NCR, we have seen this 5% level for about 2 weeks now. And in fact, as we mentioned, it's already down to 3%, which is the lowest I think I have seen it in the NCR since the beginning of the pandemic when we started testing. So these are still good numbers, even if we don't have the complete information on the contact tracing. Thank you.
James, I'd like to comment on this, which is why Octa's constant recommendation is that, government sustain expanded testing, tracing, and isolation. And, we've focused a lot on the National Capital Region, on places like Metro Davao, Cebu. But things people have to understand, vaccination is very high in National Capital Region, but it's quite low everywhere else. No, there's some improvements in Metro Davao, Cebu. Those that were included in the NCR Plus model of government. We still have a long way to go. 35% of the adult population, the target population, has been fully vaccinated. So this is not we're not yet where we're supposed to be. And there's so much that needs still to be done as far as vaccination is concerned. And while we're vaxing to the max, as we quote Joey Concepcion, we also have to be mindful that while we're doing this, that testing, tracing, and isolation facilities have to be expanded outside of the National Capital Region. And again, our constant plea is that budget for contact tracing has to be sustained, throughout this year and next year, so that we can sustain the gains that we've achieved, not just in the National Capital Region, but all over the country. Contact tracing budgets, the people take this for granted, but actually you can't have contact tracing without paying contact tracers. It's an activity that's heavy on manpower and specialized manpower that the government needs to pay for this. And the budgets for the National Capital Region, where we have many of the cases, is already going to be depleted. No, this month for the DOLE contact tracers, and of course for DILG end of December. So we have to ensure continuity as far as that's concerned. A corollary question I want to answer now, about what you call information, the information drive of the DOH. The information drive is there, and we recognize it. No, in fact, 6 out of 10 Filipinos are willing to get themselves vaccinated. So the majority of the Filipino population, adult population, target population, want to get vaccinated. Okay, but there is a growing number, a minority nonetheless, but a growing number of adult Filipinos who are deciding not to get vaccinated. And we feel that given that we can identify where they are, Balance Luzon, largely in Visayas and in classes DNE, that an approach to informing our citizens in these areas and in these socioeconomic classes can be construed or developed by the Department of Health. Yes, there might be a disconnect for classes DNE, but I'm sure once our fellow countrymen are informed, once the vaccination process is optimized and is made more efficient in the provinces, more and more Filipinos will be convinced. I believe that was what happened in the National Capital Region. There was some hesitation at the start of the year, but now because the vaccination process unfolded efficiently and effectively, more and more Filipinos began to in the national capital began to be convinced of the importance of vaccination. I believe if that process can be undertaken in the provinces, in Visayas, in Mindanao, and in parts of Luzon over the next few months, that more and more of our, together with the information drive, that more and more of our countrymen will begin to be informed and be less hesitant to get themselves vaccinated. So that's the point of showing that data, and something that we should all constantly look into, because it increased from last quarter, the hesitancy, I should say. Thank you.
Okay, thank you, Professor. And the next person with a question is Mr. Aiko Miguel from UNTV.
Hello po, good morning. Yes po, anyone from OCTA po can answer po. Some Western and even European countries that implemented optional wearing of face masks had reported resurgence. Do you think po it is also applicable in the country to make wearing of face masks optional when more Filipinos are inoculated by 2022? Thank you po.
Oh, I'll take that question, since I live in a country right now where the wearing of face masks is optional. In the last 3 months, there have been significant studies that have shown the tremendous efficacy of face masks to stop the transmission of COVID-19. I therefore believe that, especially since we are, undergoing a calibrated reopening, that it is prudent for us to maintain face masks as we reopen. Now, with regards to face shields, that is a completely different question, only because at this time, when we implemented face shields last year, there are no vaccinations. And so the question now is, with the significant protection of vaccinations, I mean, this is the game changer here. With the significant vaccine protection afforded by vaccination, as well as with face masks and other minimum health standards, is the country willing to relieve our kababayans of the burden of face shields for a much smaller decrease in risk, right? So the famous model is the Swiss cheese model, where every single slice adds protection. And this, I think, was reasonable when we had no vaccinations. But I think what you're seeing around the world right now is that vaccinations, along with face masks, as long as with minimum public health standards, it appears that those three together, without face shields, appears to provide significant population protection to prevent a surge. And so this is a matter of the DOH and the IATF wondering whether or not the 2% of added protection, in addition to the 90-some% protection afforded by both vaccination and masks together, if that 2% is something that we can negotiate upon, especially since it's very clear that the Filipinos, like everyone else in the world, is basically exhausted from COVID-19. So my personal view is, I believe we should retain face masks until we have significant vaccine protection. PA Joy pointed out, we're dealing with 90%. If we can get 90%, then we can consider removing face masks. However, I think this is the point in time for highly vaccinated areas like the NCR, when we can consider whether or not the additional protection of face shields is justified in light of the significant protection we have with vaccinations and everything else, and the burdens that our people have to go through, especially when it's raining outside.
Thank you,
Father, let's just clarify. We're still promoting the use of face masks as this.
We absolutely,
in the
use
national
of
capital
face
region,
mask
everywhere
at
else.
this time
Yeah.
is as absolute. It is the face shields that we're asking, and this is a matter of prudence. There is data that suggests there is protection, but the protection is very small, number one. And number two, it requires, in a sense, expert use of the face shield. So if you're not using the face shield well, then that extra little protection is down to zero. And so in light of the fact that we have significant protection from vaccination and masks and social distancing, the question now is whether or not our country can relax the face shield requirement in light of the added protections we got from vaccinations.
Okay.
Okay, thank you, Father. And the next person on the list with a question is Ms. Jillian Ropero from ABS-CBN. Can you unmute her?
Hello, good morning. This is also a question about shifting Metro Manila to alert level 1. Is another surge possible if restrictions are eased, as the efficacy of some COVID-19 vaccines supposedly wane after 6 months and government has yet to administer third doses and booster shots?
Maybe I'll answer this. No, OCTA, the basic position of OCTA, and with great, of course, with great respect to our reactor, Mr. Joey Concepcion, is really towards a gradual, safe reopening, and we leave it up to government to decide what level that will be. No, but we have already taken a position that we are qualified for level 2, as long as, and this is very important, as long as there's a strict enforcement and compliance with minimum public health standards, as long as there is continued testing, tracing, and isolation in the National Capital Region, and as long as the vaccination of the unvaccinated, the remaining unvaccinated target population continues in the National Capital Region. So I think government has already decided on that, and very soon we'll see what the impact of all of this loosening up of restrictions will be, and OCTA will observe. If there's going to be a significant increase, we will report it to the public. If there's no significant increase, we will also report and maybe support further loosening in the future. So this is, I think, our basic position as a group. We observe, after a certain period of time of implementing a particular level and the loosening of restrictions.
Maybe I can add to that. When an area like NCR hits 90%, and I think they could come close to 100% pretty soon, automatically that area should be given already a status of fully opening up NCR to alert level 1, because bulk of its population would be fully vaccinated. And as explained by Father Nick, provided those getting infected are fully vaccinated, then we will prevent hospitalizations and move towards an endemic, maybe in NCR first. The rest of the country will take its course. But that my greatest fear right now is that we have a lot of vaccines in the country. We have a lot of vaccines arriving in the country. So the supply is going to be more than adequate. Let's be more aggressive in allowing all sectors, whether for the booster, whether for the 2 doses, let's accelerate, because we cannot afford that these vaccines will get expired.
Yeah, I agree, Sir Joey. I mean, that's a big issue now. The logistics, optimizing the vaccination process is the key challenge now. And the challenge is logistics. The challenge is resources. The challenge is vaccine hesitancy. And I think if we all work together, we will be able to go to the next few months, with significant achievement as far as vaccinations. So I think I heard we're at 500,000 vaccinations a day. The target's about 1 million. We believe now even at 500,000, we'll be able to finish everything, Guido, by July, of next year. Much later than the government target, which is May of this year. But I'm very sure, once we get all systems go and there's greater cooperation between the private sector, our communities, and local and national government, that will get this done sooner than later.
Okay, thank you for that.
There's
Professor.
James, there's a question by Leigh Alvis. She's raised her hand sometime. Yeah, can we recognize her?
Okay, we can go with her now. Miss Leigh Alvis, can you unmute her? But we have a couple more questions after that from Mr. Jacob
Okay.
and Ms. Kathleen.
Okay.
Good morning, sir. Sir, to Sir Ranjit, I'm just curious kung the survey result differs from the SWS survey, which shows that willingness has increased, and their survey was also done in September.
Yeah. Yeah, obviously it's very different. They conducted their survey towards the last week of September, and but the reading is, in some sense consistent. No, I don't know if they measured vaccine willingness. I'm not certain of that, but they did measure the number of people who got their first and second dose, and it's more or less showing the same trend, which is that a lot of people got vaccinated during this period of time, this quarter, and a bulk of the vaccinations were done in the National Capital Region. That a significant number, as compared to the first quarter, have gotten themselves vaccinated. So these are the things that I think are common trends in both surveys, but they're very different. Yeah.
Okay, and then to Professor David, when do you see the situation would warrant the shift of NCR to alert level 1?
Well, actually, we support the further increasing of capacities in businesses, but this is, of course, a decision by the IATF and the Department of Health, because not all the metrics we look at are exactly aligned with the metrics that they're looking at, because we're using a different criteria. But based on what I heard, Sec Duque said that if we could get it down to 1,000 cases, or I think even 500 cases, I think that would be the criteria for alert level 1. I'm not sure what he meant, though, because 1,000 cases nationally, it would not necessarily translate to alert level 1, because it depends on what the level of cases in the NCR is. Right now, we're at around 365 cases per day in the NCR, good for an ADAR of about 2 point something, around 2.5. So based on what we're seeing, if we get it down to about 2, I mean, then our risk level will be significantly less. But again, we're going to be supporting the recommendation of the IATF and the Department of Health, because, like I said, we're looking at we have different perspectives on the criteria.
Okay, thank you, Dr. Guido David. And the next question here on the list is from Mr. Jacob Lazaro. Please unmute him.
Okay. Hi, good morning po. Can you hear me?
Yes, Jacob. Yeah, please go.
So this first question, I have 2 questions. First is for Father Nick and Professor Ranjit. In what aspect do you think our vaccine information drive is lacking? And possibly learning from the strategies of other countries, what approach can you suggest that can make our vaccine information drive more inclusive, especially for the classes D and E, where vaccine hesitancy is prominent? And I guess I'll just give my second question ako, no? For this second question, anyone can answer. Since face shield na discuss na po natin, hindi naman siya ganun ka-urgent yung need, but the DOH is eyeing the, replacing face shields with goggles. I just want to get your opinion on that.
Okay. Okay. Well, I'll answer first, Father Nick, and then the first question really is important, because information drive. When you do an information campaign, it has to be structured for your clientele, for your public, for the target audience that you need to inform, and maybe DNE will need a different type of information campaign on radio, on TV, on the internet. We've been working very closely with local governments now, well-run local governments like Las Piñas, Taguig, and Quezon City. What we're learning from their own experience on the ground is that if barangay captains together with a team, a team from either the Department of Health, the local health, the barangay health teams, or from the city hall, they can actually go house to house information campaign. And there are many ways of reaching our kababayans, when it comes to the vaccination process. And in Quezon City, what they're doing is that they have an information campaign at the ground level. So they have teams going around informing communities, informing citizens, blocks, about the advantages of getting vaccinated. And then the vaccination process is not anymore in vaccine centers. They're actually brought to the communities themselves. I think there's, at least in the case of Quezon City, there's some hesitancy among the elderly. So instead of letting the elderly go to the vaccine center, for example, people go to the houses and the communities, and then the information campaign starts that way. They go to the communities, local government teams go to the communities themselves. They organize there, they inform, and then of course they also set up the vaccination sites there, so that it's easier for our kababayans to go to the vaccine sites. A lot of the hesitation is also, at least from the case studies that we've experienced, is also trying to deal with vaccination and work, trying to deal with issues like, how do I get to the vaccination center? Yung pamasahe ko papunta sa vaccination center, ang hirap ng application process. Okay, so a lot of these things are part are part of what you call vaccine hesitancy. I don't want to get vaccinated, I don't want to leave work. So in Quezon City, for example, they dealt with that by going straight to the communities. The communities where access to information may be problematic. They're not accessible to TV or radio, so they go straight to the communities, and reach out to them. So there are many strategies that can be employed. The important thing is that the last mile, so to speak, our kababayans in DNE we have to reach out to them and inform them. And I'm very sure once they're informed, they will not hesitate to get themselves vaccinated. It's really access to information more than misinformation. That's the challenge here. And if they can be accessible to multimedia, local governments can reach out to them by going straight to the communities, informing them, and at the same time setting up the vaccination centers there. So that's the case of Quezon City, and that's how they're reaching out to the communities that are hesitant. Yeah, Father, you can add. You're muted, Father. Yeah.
Yeah, so thank you very much for that question. I don't really have much more to add to what Professor Ranjit Rai pointed out. I believe that our experience with the local government units have shown that on the ground, personal face-to-face responses are the most effective with dealing with our kababayans who are vaccine hesitant. We know from our experience that they listen to people they live with, they listen to people they're familiar with. That's where we have to go. With regards to the goggles, I am not aware of goggle using for COVID-19 anywhere else in the world. And I can understand why there would have been a concern for goggles a year ago. I am just a little bit hesitant to support goggles in light of the significant vaccination protection we already have. And we have, as PA Joey pointed out, we have to begin to live as if we believe vaccinations work. And we were able to prevent, we have not lost control by the grace of God over much of our healthcare system without goggles. And so it is strange to me that we are considering goggles at this time when the vaccination rate is substantial in the NCR, where the natural immunity is probably quite extensive because of the Delta surge, the devastation of the Delta surge. So things are different now than they were 6 months ago, a year ago. And I could imagine goggles a year ago, 6 months ago. But right now, my view is that biological immunity, the immunity by vaccination or by natural immunity from infection, is quite significant in the NCR at least. There may be other areas, but at the other areas, face shields should still be enough.
Okay, Father, thank you. And next, we see those who raised their hands. We'll get to you. But the next one on who asked is Miss Kathleen De Villa. Can you please unmute her?
Hi po. The DOH had said that it needs to intensify its case finding to ensure that the daily case count is reflective of the situation on the ground. So for you po, how should the government improve case finding, tracing, and testing to prove that cases are really on a decline? Do you think antigens should finally be included in the government data? Is this a loophole in case detection? Thank you po.
Yeah, I can answer part of that. Antigen testing should definitely be included in the data. And it hasn't been clear to me or to some of my, or to most of my colleagues, if they've already been counting antigen testing, because it was actually mentioned in their bulletin before that they would be counting antigen testing. And they already also mentioned this in, I think, an interview or a webinar, that they would be counting antigen testing. So I'm not sure if they're already counting antigen testing, but they should definitely include that. But based on what we're seeing from local government data, the amount, the volume of antigen testing would be somewhere around 10% of the volume of RT-PCR testing. I'm not sure if that would be accurate for all the other regions. Perhaps in some provinces where testing is low, it could be assumed that the volume of antigen testing is higher compared to RT-PCR. But because we're also seeing a downward trend, not just in the number of cases, but also in the positivity rate, we're seeing a downward trend in the hospital utilization. We're seeing an upward trend in the contact tracing ratio based on some local government data. We're quite confident that the trends that we are seeing are clear trends. We don't think this is artificial. There are other reasons why we suspect that these are clear trends. I won't get into it now, but perhaps some other time. Thank you.
Okay, thank you, Dr. Guido. The next question was from Bianca Anglo, but is she offline now? She's offline, but I can read you her question in case she watches this on Facebook Live. For Father Nick and Professor Ranjit, should we mandate vaccination for students for the campaign Balik Eskwela?
Let me respond. The experience in the United States is particularly striking. We have had universities that have had mandatory vaccinations and universities that did not. And what you are seeing, that universities that have mandatory vaccinations, like my own university here in Rhode Island, the caseload has been incredibly low. 1 case or 2 cases a week. We have positivity rates lower than 0.5%. And so no one is really worried about COVID-19. In some of the universities in the southern part of the United States, they did not have a vaccine mandate. One university, who I will not name, recorded 4,000 COVID-19 cases in the first month and a half of the semester. So you can see, I think that there is the numbers suggest that vaccine mandates, especially in a school setting, helps to mitigate the pandemic. And so whether or not we require students to be vaccinated, I think it makes sense that we require teachers to be vaccinated at least. And again, this will depend upon the availability of vaccines, especially vaccines that are targeted for our young people. But at least the professor should be required to have a vaccination, because you don't want them to bring any COVID into their classroom or COVID out of their classroom.
Yeah, I agree with Father Nick. But as a group, OCTA has no position on the mandating of vaccines. There's a lively discussion, and well, majority of us want really to focus on encouraging people. And when you look at the data, majority of Filipinos want to get vaccinated anyway. And it's now really a matter of how we can quickly deploy these vaccines all around the country. There is a strong willingness to get vaccinated. And yes, it is something that our CHED and our universities have to contemplate, how the priority should be to vaccinate our own faculty members first. And in my university, I think a lot of vaccination has already happened. I'm uncertain about the percentage of faculty who have been completely vaccinated, but a significant vaccination has been undertaken for faculty members in the University of the Philippines. For example, mandating it is a big issue in our country, and it's something that we have no position as a group on. But we believe in encouraging vaccination. And fortunately for our own country, there's a lot of people who are willing. There's a majority of the adult population want to get vaccinated. The key issue is accessing those vaccines. And hopefully within the next few months, more and more of our kababayans will be completely vaccinated. Yeah.
Thank you, Professor. And the next person who raised their hand was Mr. Janovic Mateo from Philippine Star. Please unmute him.
Hi, sir. Professor Ranjit, good morning. Just to follow up regarding your presentation on the survey results on the on the approval of the government's response to COVID-19. Where can we attribute the decrease in the approval ratings? Is this linked to the fact that the survey was conducted at the height of the most recent surge? And if it is related to that, do we see the possibility of the approval ratings going up again now, considering that the surge has been mitigated?
Yes, I think by and large, when you look at the period of the surge and you look at its comparison, in July, it was really the surge, the great Delta surge, that started latter part of July, that is the major cause for the drop, the 30% drop, in the approval rating of government. And of course, now that we've dealt with it, and we're opening up, over the past few weeks, and that the situation has been managed, not just in the NCR, but for the rest of the country. We expect that these government response, the rating for government response will go up.
Sir, dun ba sa survey natin, may specific question on which specific government response yung may approval, yung mataas yung approval, or kung saan yung bumaba?
Wala. We first asked them if they were aware of what government response in general was, and most adult Filipinos were aware of what a COVID response included, which is testing, tracing, isolation, and of course the provision of hospital facilities. And then we simply asked them about their approval or disapproval of the government response at that particular time. And so we have one for the first quarter, another one for the second quarter in July, and the other one, and then the latest one, our third quarter for September. And we noted a significant drop in the approval as far as government response to COVID-19 is concerned, from 80% of adult Filipinos to 50%. And the significant drop can be seen in Balance Luzon and in the National Capital Region, where, of course, we had a significant COVID surge.
Thank you po.
Yeah.
Okay, thank you again, Professor. And the last question right now from the press is from Ms. Mina. If you have a question and we did not, and we missed you, please put it in the group chat so we can see it. Ms. Mina, please unmute. Please unmute her.
Just a question from the Facebook, but I guess some of it was answered already in some of the questions from the media. So I'm good.
Oh, you're good. Okay. On that note, there are some questions. We noted some questions in the Facebook chat. Mr. Perlin saw them. Would you care to, do we have enough time? It's already 12 noon. I'm not sure if you guys are available to answer some of them.
Maybe one or two questions, James. Yeah.
One or two questions, Mr. Perlin. Mr. Perlin? Okay, Mr. Perlin, yes. Go ahead and read it.
Okay po. First question from
Okay.
First question from Aquila Luis Hernandez is, many people are saying that due to the vaccine, some of their relatives died. Like malakas naman daw po sila bago pa nagpa-vaccine, pero nung nagpa-vaccine po, nagka-complications daw po. Gaano po ba ito katotoo?
So maybe Father Nick, you can answer. You know, there's 5% of the adult population who actually believe in this, that nakakamatay ang vaccines. So maybe Father Nick, you can respond.
So thank you for that answer. I'm sorry, I'm sorry for the death experienced by the individual who asked the question. Significant studies have been done throughout the world in order to determine whether or not these vaccines are safe. And all the data from around the world suggests that the risks of these vaccines are quite minimal with regards to the benefits you would get against COVID-19. Now, could there be a person somewhere in the world who was so sick that when they were vaccinated, it became difficult for the body? Possibly. But all the data in the clinical trials, as well as the population studies, have shown that these vaccines are safe and they do not lead to deaths in the way that the vaccine hesitant individuals may think.
Okay, that's it. Yeah.
Okay, thank you, Father. We have one more question here about school.
Second question po is from Ashley Paras. What if ayaw ng parents na pabakunahan mga anak nila? Tapos takot din sila papasukin mga anak nila dahil sa COVID. Pwede pa rin po ba yung online class?
Okay, siguro I'll answer that. The CHED guidelines are pretty clear. We're in a period of transition, and the CHED is also clear that the face-to-face classes that are going to happen in the future are going to be limited. And it will be in cooperation with the school, our students, and their families, and of course, the local government. So the requirements for CHED for limited face-to-face classes are quite stringent. No? They require that the students and faculty be vaccinated, and that certain types of re-engineering as far as classrooms are undertaken by the universities that are going to host limited face-to-face classes. So siguro the answer would be to consult the Commission on Higher Education for the one asking the question. But definitely the CHED has come out with their own press release from Chairman Prospero de Vera that there are requirements that have to be met for limited, note the term, limited face-to-face classes to happen.
Okay, thank you. And one last question from Ms. Camille Alana.
Third question po is from Camille Alana. There's a great risk of mobilizing the vaccinated po. There might be a possibility of another surge. Are we prepared po ba to mitigate this?
So siguro to answer the question of Alana, siguro, and maybe we can end on this note, sa ating mga kababayan, hindi panahon, ang COVID-19 nandito pa, nakakahawa siya, nakakamatay siya, kailangan lalo pa tayo mag-iingat. Bagamat gumaganda ang sitwasyon sa National Capital Region at sa buong bansa, hindi itong sitwasyon na to, itong mga trends na to hindi permanente. Kung magpapabaya tayo, kung di tayo mag-iingat, maaaring mag-reverse itong mga trends na to at tumaas ang mga kaso. So ang panawagan namin is tuloy-tuloy pa dapat ang laban against COVID-19. Nandito pa siya. Kailangan lalo pa tayo mag-iingat, susuot tayo ng face mask. Kung andyan pang face shield, magsuot tayo ng face shield, hugas kamay, iwas, lalo na doon sa mga matataong lugar. So kailangan lalo na this coming Christmas, we need to sustain the gains that we've already achieved. And that can only happen if we all cooperate. No? We do our share. That's the private sector, our communities, and of course, local and national government. Tuloy-tuloy pa rin dapat ang testing, tracing, and isolation. Tuloy-tuloy ang vax to the max. No? Kung hindi pa kayo nagpapabakuna, magpapakuna na kayo. At para maprotektahan ang ating mga ang ating sarili at ating pamilya at manatiling laging bukas ang ating ekonomiya, sumundan natin po yung ating minimum public health standards. Yun lang ho ang siguro on that note, magpapasalamat kami sa media, nagpapasalamat kami kay PA Joey Concepcion, whose citizenship and leadership has guided us through this very significant surge over the last few months, and that we hope that we will see you again in our next press briefing. Maraming salamat po. Thank you.
Okay, thank you all for attending. Any last, maybe we can ask, do you have any last words to add to that, Mr. Joey?
Thank you, Ranjit. Thank you, Father Nick. Thank you, Professor Guido. And we hope to see you tomorrow in the town hall.
Yeah, we will be there at the town hall. Thank you.
Thank you.
Thank you to the media. Thank you to the media present. Thank you.
Thank you.
Yeah, that's also to the media to attend the town hall tomorrow.
Yes, they're attending. Thank you.
Thank you so much.
Thank you, everyone.
Okay, let's take it.
But not directly at the camera.
3, 2, take 1.
Let the breeze blow. It's getting late, darling, aren't you tired of living?